Isosorbide, or seemingly better known as isosorbide mononitrate, as a medicine, is a medication that is used for treating and preventing heart-related and chest problems such as heart failure and angina attacks, a type of chest pain. How isosorbide works is by widening blood vessels to help the blood flow and makes it easier for the heart to pump. However, isosorbide is less preferred over other medications that help reduce blood pressure, such as beta blockers. This is probably because the body is able to build a tolerance to the medication. Some of its side effects include headaches, tingling under the skin redness, nausea, hot flashes, and pain. It also has more serious side effects such as irregular heart rates, chest pain, which is kind of ironic, and shortness of breath. Two functional groups can be seen within an isosorbide structure, the ethers in green and the alcohol in red. Isosorbide also holds two Vesper angles. The oxygens, drawn in orange, are part of the bent angle, as it has two bonds that go off to a different molecule, in this case carbons and hydrogens, and two sets of valence electrons. The carbons, drawn in blue, are part of the tetrahedral angle, as it has four different bonds going off to the different molecules. A little messy, but what is being portrayed here is that because isosorbide has hydrogens and oxygen in its structure, it has a few places for water to bond to. For its oxygens, two hydrogens from a water molecule will bond to each oxygen, and for isosorbide's hydrogens, they will each bind to an oxygen from a water molecule, but only hydrogens that are bonded to an oxygen will do so. For polarity, the circled pairs are the polar bonds within the isosorbide. Oxygen to carbons and oxygen to hydrogen are polar because they are within the polar range, that being 0.5 to 1.9. The carbon to hydrogens are not polar because they fall just beneath this range at 0.4. Isosorbide is only able to participate in two forms of interactions, those being hydrophobic and hydrogen bonding. It is unable to participate in ionic interactions because it does not have any ions to share or bond to others, although isosorbide mononitrate does have ions, so that would be able to participate in ionic interactions if needed. Isosorbide has four chiral carbons, and they are the ones highlighted in green. Isosorbide is not affected by pH because it does not carry any of the acid-base functional groups which help certain drugs to react and change forms depending on the solution it is in. I also learned that medicines that are slightly soluble need a higher dose, which isosorbide is. Along with the higher dose, because isosorbide is slightly soluble, it may take a while for it to become effective, which is why it is considered an extended-release medicine. But once it becomes effective, it can last up to 10 hours.